Do you suffer from bad breath even after brushing your teeth properly? The underlying cause of bad breath may not be always poor dental hygiene. There are some reasons which cause bad breath even after brushing your teeth. So without any further delay, let's get into that. If you are seeing me for the first time, hi, my name is Jessie and you're watching Jessopedia. If you're not brushing properly or regularly, the small food particles can get stuck between your teeth, your gums, or even on your tongue. And these decayed food particles can result in the overgrowth of certain types of bacteria, which can produce volatile sulfuric compounds or VSCs. And these compounds are the main reason behind halitosis or bad breath. But if your bad breath or halitosis persists even after practicing a good oral or dental hygiene, that means there are some underlying issues. My first reason is that you are not cleaning your tongue properly, especially the back of your tongue. Our tongue has many grooves and crevices, so this makes the tongue an ideal place for the bacteria to hide and produce VSCs or volatile sulfuric compounds, which may lead to bad breath. Our toothbrush or even the tongue scraper cannot reach the back of our tongue without gagging. So it is very easy for our tongue to get dirty, and this may be the main reason for our bad breath. My second reason is cavities in your teeth and gum infections or gum diseases. It's very easy for the bacteria to hide inside these cavities and cause bad breath. Same is the condition with gum infections or gum diseases. So, before trying to fix your bad breath with brushing many times a day, please go and consult your dentist and fix the problem. Another major reason for halitosis or bad breath is dryness of your mouth or simply dry mouth. Saliva inside our mouth plays a very important role in oral hygiene or oral health other than digestion. It keeps our mouth hydrated and it keeps the bacterial growth under control. So, due to many reasons, that is alcoholism or smoking or whatever it is, if our mouth is getting dried out or if we are having dry mouth, this may lead to overgrowth of this bacterial population and can lead to bad breath. This bad breath can also increase the risk of having gingivitis or gum infections or even tooth decay. The next reason for bad breath may come as a shock to many of you, but sadly it is very true. Yes, it is stress. Stress or anxiety or depression can cause bad breath. When you are going through chronic stress or anxiety or depression, your mouth can become extremely dry. The main reason for this extreme dryness of your mouth may be due to the spike in some of the stress hormones like cortisol. This may lead to extreme dryness, and this dryness can lead to bacterial overpopulation leading to bad breath. I have read that even your microbiome changes when you are going through chronic stress or panic attacks. So the root cause of your bad breath is your stress. Brushing your teeth many times a day or flossing will not fix the problem. Work on your stress first. Our next reason is certain habits and certain food items. About habits we have already discussed. Smoking and alcoholism can lead to extreme dry mouth and increased bacterial population leading to bad breath. And this dry mouth can also increase your risk of gingivitis or gum infections or cavities or even your tooth decay. Certain food items like onion and garlic can also cause bad breath, and this bad breath continues even for some days. Even your caffeinated drinks or your coffee can also cause bad breath. Otherwise also sweets or sugary food are not great for your oral hygiene. Another reason for halitosis or bad breath may be certain health conditions or diseases. GERD or gastroesophageal reflux disease is one major example. When the muscle ring at the base of your esophagus is not functioning properly, the contents of your stomach may come up. This can lead to hyperacidity and eventually bad breath. So you have to fix this issue first before fixing your bad breath. Other diseases like diabetes or rhinitis or even your sinus infections or your sinusitis can also lead to bad breath. Or common cold or your cold and flu can also lead to bad breath. Next is certain medications. There are some medicines which can completely dry out our mouth, leading to bad breath. The examples are your antidepressants or your diuretics or even your blood pressure medicines. My last point on today's list is dental appliances. If you are wearing poorly fitted dentures or if you are wearing dentures which aren't cleaned properly, this can lead to bad breath. Same is the condition if you are having braces on your teeth. If you are having braces, please take an extra time and clean your teeth thoroughly and properly. Otherwise, this can lead to bad breath. What do you mean by practicing a good dental or oral hygiene? Brushing your teeth twice a day with a fluoride toothpaste, flossing regularly, cleaning your tongue thoroughly, especially at the back of your tongue, then leading a very healthy life. That means having a balanced and healthy diet and drinking sufficient quantities of water. That means you're already practicing a good oral or dental hygiene. If you are doing all these things and practicing a good dental hygiene, still experiencing bad breath, that means you have an underlying issue or condition. Please don't try to fix it with some home remedies or some tips and tricks. Please do consult your dentist or doctor and find out the root cause and try to fix the problem. Thank you so much for listening to me. Thank you so much for watching this video. Don't forget to smile and don't forget to love yourself.